is built and is marketed to employees very clearly as something that's independent of the employer. You know, when someone signs in, they opt into the system. They don't have to join the system. It's an opt-in only system. If they do so, they're certainly authenticated as being part of the company's plan. But thereafter, that's a completely independent relationship with Dossia and the employee. And it's very clear that the data isn't visible to or mined by the employer and all that kind of stuff. And for the most part, I think the logic that people go through when they ask themselves the question, shall I set up a Dossia account if I'm a Walmart employer, an Intel employer, whatever, is very much the same that my other fellow panelists have mentioned. I mean, is there real value in doing this? The perfectly secure, perfectly protected data that's immovable is useless. It has to be liquid. I have to share it with somebody. I have to be able to share it with my doctor, with my friend, with a fellow patient of my particular kind of cancer that I'd like to get some advice from. I mean, that involves, you've got to transfer the data. So at some point, people are making a value versus risk calculation the same way they do with their banking records, the same way they do with their health data. Is the value I get from the system, does it save me time? Does it improve my outcomes? Does it help me look after my family members in the order that David listed them? If it does that, then I will use the system. And I think for the most part, people are smart. They understand that they are at risk, and they certainly are being treated inefficiently in the system today. Their data is scattered all over the place. They don't get visibility to do it. People understand the value. Must be an important point. They're being cheered from the back. It's a game? I can imagine. Yeah, I'm sure. So let's go next door and have this. No. So, you know, if people see value and have fun applications and engaging applications that enable them to do useful things, they will make the decision about what system they'll use and what level of risk they're willing to accept. And I think in general, once stuff is digitized to a large extent, there are much better controls over who sees the information and how to protect it than in many cases it would be if it was on paper. So, you know, employees are smart, and where there's value, they will adopt the system, and we're seeing that all over the place.
Okay, now I have a question for the general panel. Maybe I'll let you, Chuck, start with it. But my question is, when we pass the stimulus bill and all that money that we're going to be spending on digitizing healthcare, the healthcare system, there was also an extension and expansion of the regulations with regards to HIPAA. And I'm just wondering, at this point, Chuck and the rest of the panel, is the government doing enough today to secure personal health information for the consumer?
I'd ultimately say that it's not the government that's going to be making those decisions. They're not the ones who are going to be making the security. What they're doing is laying the groundwork in the laws that say you have to operate in a particular fashion, or we will pursue you legally, and we'll create the right recourse for how that information should be handled. So I would say that by putting legal and regulatory authority in place, yes, they're certainly doing the right things in that particular sense, because they've put real penalties in place, whether it's financial or whether it's actually jail terms. They've actually now corrected an issue that was quite blaring from the first HIPAA laws, in that there's no authority. They finally identified that as CMS a couple of years ago, actually last year. So now we actually have the agency that's in charge of enforcing the HIPAA laws. So I think that from their perspective, yes, they're doing what they can in setting the right standards and setting the right laws in place. But ultimately, it's going to be the companies. It's going to be the organizations who actually sell the records to actually install this type of activity. It's going to be personally somewhat individual responsibility as well, being you have to, in essence, opt into these systems. So at some point, you're taking your own risk in order to load that data into it as well. And I'm going to tie this back to the point that David and Colin both were making, and that is around value. It's a cost-benefit ratio. I was actually actively involved in the Massachusetts eHealth Collaborative, and one of the communities that we installed this in back in 2004 through 2007 with the EHR, the community itself, every individual in that city had to opt in to use the EHR in that particular case. And when we actually offered them that opportunity, explained to them what the benefits were going to be if they opted into this complete digitized system, 96% of them did. So that's an important statement to say that the majority of people, if you explain the value, if you explain what the benefits are for using these types of systems, will assume that risk and take that risk willingly in the U.S. And I think that it's clear, though, that we have to understand what that benefit is for them and have to clearly enunciate what that benefit's going to be for them before they'll take that risk, though. So, but to your point, though, I think the government is doing the right things.
Anyone else?
Yeah, well, I'll just to, in the interest of stimulating debate, I think yet again a lot of the laws that were passed create the illusion of doing something useful, but in fact make the matters worse. You know, yes, HIPAA was extended. Yes, it looked like great controls are put in place, but HIPAA is a pretty poorly enforced law, and certainly as a company that's delivering a system that's largely targeted at consumers, states attorneys general and the FTC, in general, protecting consumers' rights through their broad powers to make sure that companies don't make promises they don't follow up on, is actually a lot more of a useful, you know, a more powerful regime than HHS and HIPAA actually is. Because for the most part, HIPAA governs the control of information that's whizzing around the healthcare system, and it has to move there anyway. You can't stop it if you want to get, you know, treated. Whereas on the consumer-facing sites, where a lot of people have got, you know, certainly mobile devices, a lot of consumer device connections and so forth, the real issues are, in order to make it compelling to consumers, you've got to make promises about how private it is. We've all done that. And the state's attorneys general, AG, stands for aspiring governor for the most part. You know, they're anxious.
Senator.
They're anxious to find somebody to go after. So I sort of, it's a bit like the, you know, kosher hot dogs. I'm appealing to a higher authority here. You know, I'm making sure that I'm protecting myself relative to states attorney general, the FTC, more than HHS for the most part. And in general, the hodgepodge of laws that exist in the US is a nightmare for us to deal with, I'm sure. And it's counterproductive in many ways because there's so many, in some states, things that are mandatory illegal somewhere else. I mean, it's a complete mess. And I think at the end of the day, the consumer is harmed by it because it's really hard to figure out how to navigate the system.
I would just add an example that we're dealing with now, which is it isn't that you decide once to be secure. You continuously decide how to balance security and privacy with ease of use and the convenience. So an example that we continue to grapple with is we have a capability within our system for proxy, meaning you can, a person, my mom, can go on and assign me the accountability and the ability to go look at her records. But how often do you and should a system ask for that permission? So it gets really tricky. You know, HIPAA would say, well, you ought to ask for it. You know, they don't determine how often, but the lawyers are always the ones trying to interpret HIPAA law. So we grapple continuously where the operations of a healthcare system is saying, you got to make this easy. Aging people are not going to be able to go into a system once a year and say, yep, my daughter can still look at my records. So the system, on behalf of patients, is always wanting to make that as long as possible. If you were to take a strict security and privacy approach, you would say, well, let's get that every single year. Well, then you have a system where you're having to go ping people very frequently to extend access. I won't even get started on the teenage access because that varies by state, and you actually end up with a donut hole for 12-year-olds who are, you know, end one law and haven't begun yet coverage under another. So I would say HIPAA isn't there because they're working at such a high level, and when you actually get down into the design of how a given feature needs to work in relationship with families and multiple people and care providers, it is weeds. It is hours and hours of conversations with all good intent, because a good organization wants to respect the laws. You don't want to go off and break the law, but you also are representing people who are trying to get their health care, and you're representing people who are trying to help people get healthier. And those two often come really at crossroads. And I'd say that actually is really the heart of the work itself, much more than what law should get passed or, you know, should we, you know, all figure out how to make this work together. It's going to be tricky. It is not for the faint of heart.
I think we're going into tax season, so I think the government's doing a fabulous job. That's what I think.
Okay.
Just want to add that. But I have one other thing to add.
Real short.
You know, let's face it, the government has done long strides in starting to at least try to understand this. So it's probably going to get a little bit more complicated before we start to make it easier. So I think we need to look at it that it's kind of like some progress is kind of better than none, and they're going to